Բարև ձեզ սիրելի հայրենակիցներ, նորից մենք հանդիպում ենք միասին մեր այս եթերում, մենք այսօր ունենք բավականին շատ խելացի եւ շատ կարեւոր մի հյուր, ես նրան շուտով կներկայացնեմ, բայց մինչեւ նրան ներկայացնելը ես կուզեի, որ դուք բոլորդ զանգահարեիք ձեր բարեկամներին, ձեր հարևաններին եւ բոլորին խնդրեիք, որ նրանք նայեին մեր շոուն, որովհետեւ մենք այսօր ունենք բավականին շատ կարեւոր տեղեկություններ կապված Medicare-ի հետ եւ այդ փոփոխությունների մասին, որոնց մասին մենք արդեն ամիսներ ի վեր որ խոսում ենք։ Այսօր մեր հյուրն է Emma Daugherty, Senior Outreach Coordinator։ Emma-ն այսօր ներկայացնում է Ես կուզեի մի քիչ անգլերենով ասել, հետո հայերենով կթարգմանեմ։ Emma is the Senior Outreach Coordinator at HOSPICE Consulting, the primary consulting firm working with the state, the Department of Healthcare Services and the Coordinated Care Initiative. Emma works with consumers, advocates, and provides to provide information on these upcoming healthcare changes, focusing on what the new programs are, when they are happening, and what people need to do to make a decision. Ուրեմն Էման աշխատում է ինքը coordinator է, outreach coordinator համայնքին եւ աշխատում է HOSPICE Consulting company կողմից եւ նրանց նպատակը նրանք աշխատում են Department Health կառավարության հետ միասին, այսինքն նրանց կողմից հաստատված են եւ նրանք աշխատում են օգնել մարդկանց եւ իհարկե բժիշկներին եւ բոլոր այն մարդկանց, ովքեր պետք ունեն տեղեկություններ այս առողջապահության հետ կապված փոփոխությունների հետ։ Հիմա մենք կուզենք ներկայացնել Emma-ին. Hi Emma, thank you for coming to our show.
Thank you so much for having me.
I know we've been talking with emails and we're trying to find a date. I know you're very busy, but thank you so much for being our guest. Emma, we've been talking about this healthcare changes with Medi-Cal, the healthcare changes with Medi-Medis, dual affiliations. So to be honest with you, I myself, I've been in managed care for so many years. I understand managed care, but today I don't. I'm very confused because there's so many things going on. There's so many changes. Can you tell us a little bit more about what's coming so everybody would understand what to expect next couple of months?
Sure. So there's a lot of information out there right now and a lot of different people talking about these changes. And so we'll walk through sort of what the changes are
Yes.
And what people need to expect. The first thing is that these changes are going to affect people who have both Medicare and Medi-Cal, or people who have only Medi-Cal. So everyone else will be unaffected by these changes that we're talking about today.
Yes.
So the changes that are happening, the state and the federal government have come together and they have created what's called the Coordinated Care Initiative. And what the Coordinated Care Initiative is working to do is it's working to address some of the fragmentation that is in the system today. Right now, for people who are dual eligibles, who have both Medicare and Medi-Cal, it can be a pretty complicated system. For both people who have those systems and for providers, it can be very challenging to figure out all of the different pieces, how they work together, and there's not enough support in the system right now for providers or for consumers. And so the Coordinated Care Initiative is coming in and it's trying to find a way to better have both Medicare and Medi-Cal work together for people. So people who have Medicare and Medi-Cal, they are going to have the option to join a Cal Medi-Connect plan. And so there's 5 different Cal Medi-Connect plans in Los Angeles County. And if anyone joins a Cal Medi-Connect plan, it will combine their Medicare and Medi-Cal under one plan. And so all the Cal Medi-Connect plans will cover everything that's currently covered by Medicare and by Medi-Cal today. So it's really simplifying the system by having all of those services provided straight through without one Cal Medi-Connect plan.
I see. Today, like my father, for example, my father received a letter from Cal Medi-Connect. My sister called me because I'm the first one that they call when there is a health-related issue or a problem, To be honest with you, I wasn't sure exactly what to tell my sister, and I said, just hold on, I'm meeting with an expert. I will get more information, I will get back to you. And I had a lot of other people, my viewers, and thank you for my viewers for their trusting me. They've been calling me, they've been coming to my office with the letters they've been receiving from CalMedi Connect. Now, I wanted to talk about that. This is a reality. People are getting these letters from the letter is only comes from CalMedi Connect, right?
It comes from the state. So it comes in a blue envelope from the Department of Healthcare Services.
So CalMedi Connect is the state.
CalMedi Connect is a program that the state is offering. The state's the Department of Healthcare Services.
But the letter is coming from the state.
Yes,
right?
In a blue envelope.
The blue envelope.
Exactly.
And how is it determined? Like, who gets the letter? Is it by age? Is it by birth date? Can you tell us more about that?
Excellent questions. So the enrollment process is happening based on, for most people, it's based on their birth month. So it's beginning in Los Angeles in July, and then it's continuing on for 12 months. So people who have their birthday in July, since we're in June right now, they've already gotten notices. And so people who are eligible for the program are going to have Medicare Parts A and B, as well as Medi-Cal. So that's having their Medicare card, it's that red and blue card, and then the white Medi-Cal card. And so they're going to get 3 different notices. All of them will come in blue envelopes from the state. And so if they get one of those, then they need to make a decision. And so the first notice that comes, it's just a heads up. It says, more information is coming, keep watching your mail.
Yes.
The second one that comes, that's going to come 2 months before their birth month. And the second one that comes, it's a bigger mailing. It also has a guidebook and a choice form. And so that's when people can decide, yes, I want to join CalMedi Connect, or they can choose not to join CalMedi Connect. And so they can choose to join a CalMedi Connect plan, but they also don't have to do that.
So, for example, my father now he received the second letter. So, and of course, my sister is kind of panicking because she was wanting to make a decision. So the third letter that my father gets, so we have to make a decision.
So you make the decision when the second letter comes.
Oh, second letter comes. Okay, so there is no third letter then.
Then the third letter comes and it confirms whatever
decision you make. I see. So in this case, you have a choice of joining CalMedi Connect, and you said CalMedi Connect has a couple of, there are different health plans that are contracted with, or they can join. Can they join another medical group, or they have to choose either CalMedi Connect or how's that part? So
there's two different options under the Coordinated Care Initiative. And so the first option is a CalMedi Connect plan. The plans that are offered in LA are LA Care, HealthNet, Care First, Care More, and Molina.
So what are the big ones?
Yes, those are 5 pretty big plans. Big ones, and so if anybody wants to join CalMedi Connect, they would choose one of those plans for CalMedi Connect, and then all of their Medicare and Medi-Cal would be straight through that one plan. They also get an additional vision and transportation benefit. But if they decide for whatever reason they don't want to do that, then they would keep their Medicare the way it is. So any of their Medicare covers your doctors and your hospitals and prescription drugs. So all of those services would remain as they are today, but people would need to enroll their Medi-Cal into a health plan. And it's very similar to the options for CalMedi Connect. It's HealthNet, Molina, LA Care, Care First, and then Anthem Blue Cross, which is a sister plan with Care More.
Okay. Yes, I think they joined Blue Cross and Care More. Yes,
they're like sisters.
Because in my old back life, I used to work with Care More with the health plan. So they told me that they're joining together. So I want to understand this right. So I want to go back. So people who are straight Medi-Cal, they are in managed care anyway.
And if they're not, then they need to choose a managed care plan. That's mandatory.
No, just people who are not Medi-Medis, just the regular, they only have Medi-Cal. I remember, just a couple of years ago, that became mandatory, so everyone had to go and join a medical group with the health plan. So now we're talking about those people who are Medi-Cal, Medicare.
Exactly.
So now the issue here is that if they need to join the Cal Medi-Connect and Medi-Cal, there's no choice. They have to choose a plan for Medi-Cal, right?
Exactly. If they don't join, they can join Cal Medi-Connect, but if they decide they don't want to do that, then they have to choose a plan for their Medi-Cal.
So Medi-Cal, they have to. It's a mandatory.
Exactly.
But for the Medicare part, they have an option. Either they can join the Cal Medi-Connect or they can leave it as is.
Exactly.
Okay, but my question is, if they leave it as is, can they still continue care with their doctors that they were seeing?
Yes, so if they choose only to join a Medi-Cal plan, then all of their Medicare services, so any doctors they see, any hospitals, all their prescription drugs, all of that will be the exact same as it is today. That won't change. If they join a Cal Medi-Connect plan, they should check that their doctor works with the Cal Medi-Connect plan network. Because once you join a Cal Medi-Connect plan, your doctors are coming from within that health plan's network. And so we have some resources available. People can call the health plans, and they can also call HiCap, which is a counseling center. It offers free, unbiased counseling, and they can call there to get help with figuring all of this out.
But my understanding, because there is a question whether people should join, for talking about the Medicare, if they're Medicare, they should join a medical group or a health plan, or they should leave it as is. So my understanding is, with my experience with all these years, if they choose a health plan, they will get more benefits as far as their Medicare benefits, right?
They will have additional benefits through Cal Medi-Connect.
Additional benefits.
Exactly.
Yes.
There's an additional vision benefit. It's one routine eye exam annually, and it's $100 towards eyeglasses or contacts every 2 years. And then there's an additional transportation benefit. And so the transportation is if people have trouble getting to pick up their prescriptions or getting to a doctor's appointment, the transportation can be used for that. And so it's 30 one-way trips every year.
But as far as their medications and as far as for example, if I know that with CareMore, at least I know that if the patient travels to another country and if something happens to them, they cover about $50,000. That's a benefit that the health plan has. So these are kind of benefits that people need to understand, and especially what diagnosis they have and what medications they need, because some of the health plans they have better coverage for medications and for services, so they have to determine what's best for them. Because at this time people have what happens is they ask me, is it mandatory? Do we have to join a medical group, or do we have to join a health plan, or we have to stay as is? But they're the ones to determine what's best for them.
Exactly. It's a really personal decision. And so I wish that I could tell everyone, I know the answer, I know what you should do. But it really depends a lot on what that person, what their care is, what doctors are seeing right now, and what they're looking like down the road they might need for their health care. And so depending on, on a lot of different factors, joining a Cal Medi-Connect plan might be best for them if they want that additional vision, or if they want that transportation, or some of the other benefits that Cal Medi-Connect plans can offer. That could be a really good option for them. But for other people, maybe if their doctor is not with one of the plans, or for whatever other reason, it probably would be best for them not to join a Cal Medi-Connect plan. And so it's going to be different for everyone. It's just that people really should know what's out there, what the options are, and we encourage people to call the plans, get more information from them so that they can make an informed decision.
I know that everybody knows that I work with the Maverick Medical Group, and I support them, and I'm like an advocate for this medical group because I really trust Dr. Hosseinian and everybody that's behind working with them. And I know that in this community, at least our physicians are getting contracts with the medical group, and they got all the hospitals in that one group and the specialists that they need. So, everyone's doing their best, the groups and the department health, everyone. But I think one thing that we want to tell our viewers that this is reality. So they have to choose, they have to one way or the other. And I know they're getting these notices in Armenian, right?
Yes.
So those viewers that they don't speak English. And what happens if they don't do anything with these papers?
Excellent
Just
question.
put it aside.
And I definitely want to talk about that. For anyone who's eligible for CalMedi Connect, the state will provide a plan that's the best match for them. And they'll get that information when they get the second notice. And if they're happy with that plan, or if they don't see that plan, then they're going to be automatically enrolled into that CalMedi Connect plan. And so that the state's looking at past medical data to find the best match, but it's not always going to be perfect. And so we really encourage people to look at that, and if they like it, then that's great. They'll be automatically enrolled into that plan. But if they're not happy with that choice, they should sort through, figure out what they do want, and they should make that decision.
So in order to prevent that, because I know that, with our viewers with my Armenian community, if most of them, they will just not do anything, they will just put this aside. That's the reason we're having these TV programs, because we're trying to educate them. So if they don't choose a plan, or if they just put this aside, the state will choose it for them, and then we don't want anybody getting upset. That's why we want everybody to do their homework, to read these letters that comes in Armenian, or to call us. They know my number. If they have any questions, we can guide them, we can give them directions. But the bottom line is everyone has to read. Like my sister, she reads everything that comes from my dad, and she's like, she takes care of them. And then she would call me and what direction we need to go. Now I know that, I need to call my father's primary physician. I need to ask him what groups is he joining and what should we do, because my dad really wants to continue care with his doctor, who is Dr. Kocharian, and we're very happy. He's one of the best doctors in Glendale. And also for people to understand the severity of this, not a problem, but it is a problem, it is an issue. It will become an issue if they don't do anything and they just put this aside. Because in the past, because I would interact with a lot of people with the managed care, Medi-Cal managed care, that they will call me and say, my dad or my mom is in the hospital, but they want to transfer him, and why are they transferring? He has Medi-Cal. But then we find out that the primary physician signed a contract with a specific group, and that patient is in that group, so the patient has to go to a hospital that's about 40 miles away. So I would try to educate them. This is what happened. Were you aware of it? No, we don't know. We're not aware of this is what's going on. So when you tell them, people get upset. That's why everyone has to do their homework like we do for our parents, and to understand this, right? So what else can you tell our viewers? Like what things they should look, or what can benefit them? Are there any phone numbers they can call if they have any questions? Are there any Armenian speaking people that can help them?
There are. So thank you so much, and I appreciate that you're doing all of the education, because exactly as you said, it's really important that people know about these changes so that they can make an informed decision. And so there are some phone numbers that will be very helpful for them. The first one is Healthcare Options. Healthcare Options is the group that's doing all of the enrollment for this program. So I want to be very clear that that's Healthcare Options, which is through the state, and insurance brokers and agents aren't doing enrollment for this program. So if someone's talking to a broker or agent, that's great, but it's probably not about this program, because all of the enrollment for this program is happening through Healthcare Options. And so if someone gets these notices, they can call Healthcare Options to make their decision. And so they can call up Healthcare Options, which has language capabilities, and so they can call them and say whichever health plan they want to join, and they can put that in and make that decision there. The other number, I mentioned HICAP earlier. Some people might know it as the Center for Healthcare Rights. It's a great organization here in Los Angeles, and they do free, unbiased counseling. So when people are looking and they're not sure how to make this decision, they can work with HICAP, which is the Center for Healthcare Rights. And they can go in and actually have an in-person session with people there. It may take a few weeks for them to get an appointment. It may take, 2 or 3 weeks to get an appointment. But if people are getting these notices, they can go ahead and call, and then they can have someone to help them walk through these decisions.
Okay, great. So there is a phone number that everybody can call, and these phone numbers are listed on those blue envelopes, those letters that they're getting.
Every notice that comes, it lists both healthcare options, which does enrollment, and then HICAP, the Center for Healthcare Rights, which does counseling.
What does counseling? Okay, and as far as that one question that I know that I was talking to someone this morning, what's important for people is to keep their specialists. And there are some people, for example, who have heart conditions. They probably don't see their primary care physician, but they're seeing their heart doctor, their cardiologist. So when somebody is going to be with this CalMedi Connect or with the group that they're going to choose, what things they should look for if they want to continue care with their, especially, cardiology is something that everybody wants to make sure if they're happy with their cardiologist, they want to, because that person knows the history. So what things they should do to keep their specialist with that group, or
Sure, that's a great point. We know that it's really important for people once they get a doctor and have that relationship with their doctor, it's important to keep that. And so the first thing that they can do is they can see if their doctor's with a CalMedi Connect plan, whether that's their specialist or whether it's their primary care
provider. So they need to call the office and find out from the office staff.
Yep, so they can call the office, they could call the health plan, they could call what they could call HICAP. There's a lot of different ways that they can figure out how if their doctor's still with the plan. And then based on that, they can make a decision of if they want to join CalMedi Connect and if their doctor is part of that, or if it's better for them to not join CalMedi Connect so they can continue to see their doctor outside of a CalMedi Connect plan.
Okay, and so the question that I have right now that comes to my mind, so all these physicians, they are that I know, because I work very closely with a lot of the physicians, and everybody's trying to, the specialists and the primaries, they're in this stage that they're trying to sign up with different medical groups, whichever medical group works best for them. So if the doctor is with a medical group and the person decides to join CalMedi Connect, and the Medi-Cal portion is only with CalMedi Connect, but they keep the Medicare open, they can still see that physician?
Sure. So if they're only putting their Medi-Cal into a plan, that's called a Medi-Cal managed care plan. And so they would just be keeping their Medi-Cal in a plan, and then their Medicare would remain as it is today. So in what we call fee-for-service, it's just, it goes untouched, it doesn't change. And by doing that, they can see any doctors, hospitals, specialists, anyone that they're seeing today, they would keep seeing them just the way they are today. So if they choose to not join a CalMedi Connect plan, keep their Medicare the way it is, they won't get those additional benefits of vision, transportation, and care coordination, but their Medicare will stay the way that it is. And so they can keep seeing doctors, hospitals, and there's no fees or anything for joining CalMedi Connect, or if someone chooses not to. There's no cost.
Because the reason I say that, because I know we have this TV program, and this TV program is solely to educate our community, and everybody knows that. But there are some other people, they're on TV, they're telling people that you don't have to join a medical group, but they're not, or you don't have to put your Medi-Cal, Medicare in a group, or CalMedi Connect, or different group, or in managed care. But they're not saying, this is what happens if you're in a medical group, or if you join a group, or a health plan, or this will happen to you if you stay regular. So that's why we are educating our people so they understand the benefits. So everybody is unique. Everybody has unique needs. So everybody needs to understand what health plans are offering, what kind of benefits. Do I need these benefits? I don't need these benefits, then you stay. So it's really up to you. But I think it's my advice would be, and I want to ask your expert advice, I think it will be a good choice for them to compare. and to see what's best for them, because you have to look at the options that the plans are offering. I know our time is coming to an end. What is the last thing that you want to tell our viewers?
Well, ARPI, I think that is great advice. People definitely need to compare and see what really is best for them. It's different for everyone. But if someone gets a blue envelope in the mail from the Department of Healthcare Services, they need to make a decision. So they should open up that mail and see what plan is best for them.
Okay, well, I want to thank you, and I'm sure I have to call you one more time. After maybe 90 day, 90 day, we'll put 90-day notice, and we'll have you come, and then I'll talk to. I want to put my dad as a sample example. I want to see what's going on, and my sister and I are working on it, and I want to share my experience with everyone, and of course your expert advice. Thank you very much for your time, and I'm sure we'll have you again. Սիրելի բարեկամներ, ինչպես որ դուք այսօր տեսաք, մենք ունեցանք բավականին կարևոր տեղեկություններ Medicare-ի հետ կապված, եւ այսօրվա մեր հյուրը Էման էր, եւ Էման մեզ տվեց բավականին լավ ինֆորմացիա, եւ Էման հաստատված է իրենց կազմակերպությունը, հաստատված են Department Health-ի կառավարության կողմից, եւ նրա ամբողջ ինֆորմեյշնները, որ նա տվեց, այսինքն մենք խոսում ենք այսօր մի մարդու մասին, որը կառավարության կողմից անձնավորություն է, եւ որ հիմա մեզ չեն կարող ասել, որ այս ինֆորմեյշնը որտեղից եք բերում եւ ինչ եք անում, բայց եթե դուք հարցումներ ունեք, խնդրում եմ, որ զանգահարեք մեզ, մենք մեծ սիրով ձեզ Քոնե ձեզ կարող ենք տալ ճիշտ ուղղություն, որ ճամփայով գնաք, որովհետև այսօր իսկապես մենք կանգնած ենք մեծ խնդիրների առջև, որովհետև մարդկանց մեծամասնությունը արդեն այս նամակները, որ նրանք ստանում են, արդեն խոճապի են մատնված։ Ինչպես որ ես նշեցի, նույնը եւ մենք, ինչպես որ ես իմ հայրիկիս համար մենք այդ թուղթերը ստացանք եւ քույրիկը զանգահարեց ինձ եւ հարցրեց, որ ինչ պետք է անենք եւ դա մեզ անհանգստացնում է, որտեղ մենք ուզում ենք, որ մեր հայրիկի, մայրիկի համար մենք ունենանք լավագույն խնամքը եւ նրանք կարողանան շարունակել իրենց խնամքը իրենց բժիշկի հետ։ Եվ ամենակարևոր մի մասը, որ մենք նշեցինք այսօր մեր հյուրի հետ, որ կարևոր է, որ մարդիկ այս նամակները, երբ որ նրանք ստանում են, առաջին նամակը, երկրորդ նամակը, երրորդ նամակը, առաջին նամակը նրանց, ինչպես որ նշեցինք, նրանց ասում են այս change-ի մասին, երկրորդ նամակը արդեն դուք պետք է այդ որոշումը կատարեք, իսկ երրորդ նամակը, որ դուք ստանում եք, արդեն նրանք հաստատում են ձեր որոշումը, եթե որոշում արել եք, եթե ոչ, նրանք այդ որոշումը կկատարեն ձեզ համար։ Դրա համար շատ կարևոր է եւ ամենակարևոր մի մասը, որ մենք նորից նշեցինք, որ դուք կարողանաք ընտրեք տարբերությունը, այսինքն տարբերությունը դուք ուզում եք մնաք ձեր, որը Medicare-ը, ինչպես նշեցինք, պարտադիր պետք է դառնա managed care եւ պլանների հետ, իսկ Medicare-ը դուք նորից choice ունեք, բայց պետք է նայեք այդ պլանները, որոնք որ նրանք տալիս են ձեզ բավականին շատ benefit-ներ։ Դրա համար կարևոր է, որ ամեն մարդ յուրահատուկ իր համար նստեն եւ իրենց ընտանիքի հետ խոսեն, երեխաների հետ խոսեն, որովհետեւ ամեն մարդ ունի տարբեր տեսակի հիվանդություններ, դեղեր, դրա համար ամեն մարդու համար տարբեր health plan կամ benefit ավելի ճիշտ կլինի, որ նրանք ընտրեն։ Շնորհակալություն եմ հայտնում ձեզ ձեր ուշադրության համար, մենք նորից կունենանք բավականին լավ հյուրեր, ես կփորձեմ, որ բերեմ մեր համայնքի ամենալավագույններին, ես խնդրում եմ, որ դուք միշտ հետևեք մեր եթերին եւ շնորհակալ եմ, որ ձեր վստահության համար, մենք նորից կհանդիպենք։